Hello, my name is Kevin McNamara and I'm the Chief Executive at the Great Western Hospitals NHS Foundation Trust. Christmas and New Year is a time many of us look back over the past 12 months to reflect on the progress we have made, and it's with this in mind I wanted to share some reflections on the progress we have made as a trust during 2022. Whilst many of us are planning for Christmas, it is clear that this Christmas feels different for many working in the NHS compared to Christmases past. Winter pressures, the waiting list backlog, challenges in social care, cost of living and strikes all make this a more demanding period than potentially at any time before for the NHS. Whilst it is a fact that these are very real challenges, it is because of this backdrop that makes the achievements of our staff and volunteers even more awe-inspiring than normal, and I'd like to take a few minutes to share with you some of the highlights. This year marked the 20th anniversary of the Great Western Hospital, and whilst it's been a good opportunity to look back over our history, it's also been a good opportunity to look forward to what the future will bring and be ambitious for how we can continue to grow, develop and innovate for the people of Swindon and Wiltshire. This year we've seen high numbers of patients in urgent and emergency care, with nearly 118,000 patients passing through our doors so far this year. When we opened the hospital in 2002, we were seeing around 50,000 people per year through our front door services. We've worked extremely hard to see patients as quickly as possible to minimise delays and speed up discharges. Anyone visiting the Great Western Hospital will know how much the site has changed in recent months. This year, after many years, we were finally able to bring radiotherapy to Swindon thanks to the incredible work of our local communities who fundraised an amazing £2.9 million. Around 26 patients a day are now being treated in the new radiotherapy centre here on site, run by the Oxford University Hospitals Trust. We've continued to bring cancer services closer to home with a new mobile PET-CT scanner on site every week. This means patients can also receive additional cancer diagnostics right here in Swindon. In the summer, we also opened the doors to our new urgent treatment centre. This £16 million build, which is more modern, inclusive, brighter and bigger, is now treating around 1,000 patients every week and is already playing an important part in managing winter demand. And it's already paving the way for our continued emergency department expansion work, which we hope to start in the new year. The new Urgent Treatment Centre also homes the Trust's first ever Changing Places facility, a bathroom for people with complex physical health needs, and is another step forward for our work on creating a more equal, diverse and inclusive environment for staff, patients and visitors. In September, a new coordination centre launched here at the Great Western, which uses live data to track every patient and ensure they're receiving the right care in the right place and at the right time, and aims to reduce the need for ambulances to be dispatched to patients by providing other care support. We've also seen 128 patients have been discharged through our Home First service, which is a new process that means people are discharged more quickly, with home assessment completed in 4 hours of a patient getting home. All of this designed to free up beds for those that really need it. Our community and primary care teams have also been treating thousands of patients outside of a hospital environment, keeping them fit and well, and our maternity team have helped deliver 4,000 babies across the community. We also welcomed our 400th internationally recruited nurse this year, an incredibly important part of the Great Western family, and our workforce continues to grow with skills and expertise from home and right across the world. Staffing in the NHS is a real challenge, but I'm pleased that we have filled nearly 40 vacancies, which are also supported by nearly 400 volunteers who give up their own time to support services across the Trust. Another major milestone for us was the launch of Improving Together, which will help us develop a culture of continuous improvement that puts patients at the heart of every change we make. Since the start, 136 staff have been trained, with more to come. All of these milestones and many more besides didn't exist last Christmas. They've only happened over the last 12 months because of the people that make up the Great Western family: the nurses, doctors, healthcare assistants, therapists, midwives, radiographers, pharmacists, phlebotomists, secretaries, managers, laboratory teams, and the over 140 other different professions that allow the Trust to do what it does best. In fact, a number of our staff have been recognised at regional and national awards, which is an incredible testament to the high standard of care provided here. We've also received hundreds of letters and messages of praise and support from the public this year, which is always fantastic to read. So whilst the challenges are very real, I do hope that as we look back over the year, you can take a sense of pride that despite all of that, progress has been made across some key areas, all of which contribute to supporting our patients and our community. It should also give confidence that we will face into the challenges ahead as a team focused on doing the best we can for our patients. I want to thank our local community and our partners across health, social care and the voluntary sector that make up the incredible patchwork of vital services supporting our local community at a critical time. I want to thank every member of staff and volunteer who will keep going to provide care for everyone who needs it in Swindon and across Wiltshire. To everyone across the area, a very Merry Christmas and a Happy New Year.